My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Says What. I'd like to tell you a couple things today. First one is a lot of new research on migraines. For those that suffer migraines, the flashes of light, the nausea, the headaches, the bright spots, and all the different things that go with migraines, not just a normal headache, and those that suffer on a regular basis, 2/3 of which are women. And as you get older, migraines can change how they affect you. But migraines can be very debilitating. So we think it's an oversensitive nervous system, somehow through environmental stressors, that you become more sensitive to certain things. But there's some great new therapies. One of the coolest, I think, is called green light therapy. Blue light can cause increased intensity in migraines, but green light can actually, and it's green light therapy, if you talk to your healthcare provider about it, can be really helpful. There's oral medications such as Nurtec and a couple others. I think there's three of them that you can take. Again, talk to your healthcare provider, that can provide some relief, especially if you have changes. Older adults tend to respond better. Nasal sprays like Zevspret are really helpful for certain patients. So again, you want to see which therapy works for you. There's been injectables for a while, and there's several new injectables, and you want to try those if that's what your healthcare provider believes is best, and you don't want some of the side effects of the oral ones. Either the nasals or the injectables work well. And then neuromodulation, and you'll have to talk to your healthcare provider about that, but there's a way that they modulate your nerve systems, and you'll have to ask more details, a little more complicated than we can go over on a podcast. But neuromodulation is something you need to bring up also. So with that, there's hope for those that suffer, and there's a lot of chronic sufferers. And if you know your triggers for having a migraine, try to reduce those triggers. I have something totally unrelated called ocular migraines, where you get spots and get the carnival ride mirror shifting, where I get several planes of my vision. And I found out my trigger is if I'm looking towards bright light and I'm in dim light, that can trigger it. So if I stay away from that, it's reduced my ocular migraines. I'm almost a non-existent unless I get in those situations. Walk outside in bright sunlight without sunglasses, that can do it. So find your triggers for actual migraines, and it'll help a lot. Last but not least, the most important thing I want to talk about today is weight control. I know you're tired of me hearing this, but the three things that you control most in your life that directly affect your health are: stop smoking. You know, it shouldn't be legal to sell cigarettes in this country, but if you smoke, stop. Do whatever you have to do. Talk to your healthcare provider. There's all kind of things, from patches to hypnosis to all kind of support groups. You've got to stop smoking. Smoking is taking a tremendous toll on the quality of your life and your wallet. And I'm not talking about just what it costs to buy cigarettes, but the health care you're going to have to be provided for the many issues you're going to have, and eventual, not just lack of quality of life, but you're going to reduce your lifespan significantly. And I know those are, say, my grandmother smoked till she was 94 or whatever. Well, she probably lived 104 if she hadn't smoked. So I know that doesn't sound like much when you're young. And if you chew tobacco, use tobacco in any way, stop. It's just 7,000 chemicals packed into, and you say it's natural, so what? I mean, eating your own poop is organic, but that doesn't make it good. Tobacco is a terrible, terrible plague to health. So stop smoking. But in addition to that, easy one, radon. Check your house for radon. Have it remediated. It doesn't cost a lot. As bad as smoking. So don't neglect that if you live in a radon area. And if you don't know, check it out. Look it up. That's what Google's for. So one of the useful things of the internet. But most important that most people can affect in their life is weight control. And I know it's a terrible subject, and you say, we have a really interesting relationship with food. I enjoy food, but I don't enjoy overeating. And you say, well, that's good for you. But I still have to watch my weight, especially as you get older, your metabolism goes down. So really think about this. Look at the DASH diet, DASH, or the Mediterranean diet, which basically are just more, less salt, more plant-based fruits, vegetables, especially lentils, beans, nuts, etc. Lean proteins such as chicken and fish, and occasional lean red meat. Cut out the excess sugar. Make sure your carbohydrates are complex and that your fats are not bad fats but good fats. Watch your waist even more than your BMI. Your body mass index is important, and you don't want to exceed the recommended guidelines, and talk to your healthcare provider, but it's usually about 26 or so. But more important than that is your waist. And I've said this many times, but your height divided by two, you don't want your waist to be any bigger than that. I'm 72 inches tall, 6 feet. So when I divide that by two, it's 36. I got to really make sure my waist does not go beyond 36 inches. That middle body fat, visceral fat. And on the autopsy, you can see it. You open a person up and you've just got this layer of fat around the middle. And it causes all kind of problems with blood pressure. It tends to be sticky inside your veins. It causes the high blood pressure is one of the symptoms, but it constricts it, causes your heart to pump harder, causes cardiac events, heart attack, stroke, all those different things. So you want to get a grip on your weight, and it's not body shaming. I don't think it's unattractive if somebody's big or small or in between, and that's not the point. But you can't argue. It's just not healthy to have excess weight. And in our culture today in America, it's a terrible thing. We waste 40% of our food, and 30% of our population has food insecurity. And part of that is we just eat too much and waste too much. So stop eating so much and start eating the right things in the right amount. Talk to your healthcare provider, talk to a good dietitian or nutritionist, and figure out how many calories at your age you can have a day at your height to get to your desired weight. And then also increase your exercise, even if it's just walking. If it's walking around the office, it'll make a huge difference. Have a great day. This is Dr. Frank. My doctor said what? And I'm on all major platforms. So have a great day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.